For years, orthopedic surgeons have observed a quiet contradiction in clinics and rehabilitation rooms. People over 75 arrive having done exactly what they were told. They walked every day, they stayed consistent, they believed they were protecting themselves, yet the injuries kept coming. Not during long walks, but while standing up, turning too quickly, or reaching slightly off balance. That gap between effort and outcome is where the truth begins. Because after 75, the greatest risk is no longer inactivity, it is a body that is being trained in ways it no longer responds to. Walking itself is not harmful. It keeps the heart working and the lungs active. But orthopedic medicine sees something walking does not address. Research published in the Journal of Gerontology shows that muscle strength declines by roughly 3% every year after the age of 75, even in active adults. This loss happens quietly, year after year, until the body no longer has enough reserve to recover when balance is challenged. At the same time, studies from the University of Pittsburgh show that proprioception, the body's internal sense of position, declines by nearly 25% between the ages of 65 and 80. The brain receives slower, weaker signals from the feet and joints, even while a person continues walking regularly. This explains why falls rarely happen while moving straight ahead on a flat path. They happen when the nervous system is surprised, a sudden turn, a sideways reach, a brief moment of stillness. Walking trains endurance in one direction. It does not load bones. It does not activate deep stabilizing muscles. It does not train fast reactions. Orthopedic surgeons regularly see patients who can walk long distances yet struggle to stand on one leg or rise from a chair without using their hands. The advice to simply walk more does not align with biomechanics. This is not about blame or fear. Falls are not a motivation problem. They're a coordination problem between strength, balance, and reaction speed. When one of those systems weakens, walking alone cannot compensate. Understanding this difference is the first step towards staying independent. Now we begin with exercise number 5, and it often surprises people because it looks almost too simple to matter. Heel-to-toe walking is not about getting more steps. It is about retraining balance at the neurological level. After the age of 75, balance problems rarely come from weak legs alone. They come from inaccurate signals between the feet and the brain. That means the brain receives slower and less reliable information about where the body is in space. To perform heel-to-toe walking correctly, begin by standing next to a wall, countertop, or sturdy surface so you can lightly touch it if needed. Stand tall, relax your shoulders, and focus your eyes on a point straight ahead. Take one slow step forward and place the heel of your front foot directly against the toes of your back foot. Shift your weight fully onto the front foot before bringing the next foot forward the same way. Each step should form a straight line, as if you were walking on a narrow beam. Move slowly and deliberately. The goal is control, not speed. Aim for 10 to 20 steps in a row, once or twice per day. A study published in the Archives of Physical Medicine and Rehabilitation found that seniors who practiced heel-to-toe walking improved dynamic balance by 19% in just 8 weeks. Dynamic balance is what protects you when turning suddenly, stepping around obstacles, or walking on uneven ground. Normal walking does not create this challenge. With a wide base of support, stabilizing muscles remain quiet and the nervous system coasts. Heel-to-toe walking removes that safety margin and forces the brain to stay engaged. As confidence improves, you can gently increase the difficulty by turning your head side to side while walking or briefly pausing on each step. Over time, many seniors notice steadier turns, calmer steps, and a renewed sense of balance they can trust in daily life. Now we move to exercise number 4, In this one determines something far more important than most people realize: whether you can remain independent as you age. Chair squats are not about building gym strength. They're about preserving the ability to stand up on your own. Research published in the European Journal of Preventive Cardiology found that performance on the sitting-rising test was one of the strongest predictors of longevity. Seniors who struggled to rise from a seated position without assistance had a 5 to 6 times higher risk of death during the study period. That makes this movement a survival skill, not a fitness trend. After the age of 75, muscle strength declines by about 3% per year, according to the Journal of Gerontology. That loss affects the quadriceps and glute muscles most, the exact muscles responsible for standing up from a chair, a toilet, or a car seat. Many seniors can still walk reasonable distances, but quietly begin relying more and more on their arms to push themselves upright. Orthopedic clinics see this pattern constantly, and it is often the first step toward loss of independence. To perform chair squats correctly, begin by sitting in a sturdy chair with your feet flat on the floor about hip-width apart. Keep your chest tall and your eyes forward. Cross your arms over your chest if you can, or extend them straight out in front of you. Lean slightly forward to bring your weight over your feet, then press through your heels and stand up fully until your hips and knees are straight. Pause briefly at the top, then slowly lower yourself back into the chair with control. The lowering phase should take about 3 seconds because that is where much of the strength benefit occurs. Aim for 2 to 3 sets of 8 to 12 repetitions per day. If standing up without using your hands is too difficult at first, use the armrests lightly and reduce assistance gradually over time. A study from Tufts University found that seniors who practiced chair squats increased leg strength by 28%, improved walking speed by 15%, and improved stair climbing ability by 22% in just 12 weeks. When this movement becomes easier, daily life becomes easier too, and confidence returns where hesitation once lived. Now we come to exercise number 3, and this is where many people finally understand why falls so often happen sideways, not straight ahead. Standing hip circles target a part of the body that walking almost completely ignores. The hips are responsible for correcting balance when you stumble, step to the side, or need to rotate quickly. Research published in the Journal of Biomechanics shows that hip mobility declines by about 20% between the ages of 65 and 80. As that mobility fades, the body loses its ability to make fast, corrective movements. Another study from the University of Maryland found that weakness in the hip abductor muscles was the single strongest predictor of falls in adults over 70. Even stronger than overall leg strength or balance test scores. To perform standing hip circles safely, stand next to a wall, chair, or countertop and lightly rest one hand on it for support. Shift your weight onto one leg. Slowly lift the opposite knee upward, then guide it out to the side, back behind you, and return it to the starting position, forming a smooth circular motion. Imagine drawing a large circle with your knee. Move slowly and with control, keeping your upper body tall and steady. Complete 5 circles in one direction, then 5 in the opposite direction before switching legs. This movement trains mobility and stability at the same time. As the hip moves through its full range, the standing leg must stabilize your body, forcing deep muscles to activate. A study published in Age and Aging found that seniors who practiced hip mobility exercises improved lateral stability by 31% and protective stepping reaction speed by about 20%. Lateral stability is what keeps you upright when you are bumped, pulled, or forced to step sideways, one of the most common causes of serious falls. Walking only moves the hips forward and backward. It never challenges rotation or side-to-side control. Standing hip circles restore those missing directions. When the hips regain mobility and strength, the body reacts faster, steps wider when needed, and stays upright in moments that once caused hesitation or fear. Now we move to exercise number 2, and this is where many seniors rethink what strength really means after 75. Isometric wall pushes do not involve lifting weights or moving joints through painful ranges. Instead, they train something far more important for fall prevention: how fast your body can generate force. Research published in the Journal of Applied Physiology shows that isometric training increased muscle force by 35% in adults over 70 compared to 20% from traditional resistance training. Even more important, the rate of force development improved by 40%. That rate is what allows you to catch yourself when you stumble. Strength that arrives too slowly cannot protect you. To perform the isometric wall push, stand facing a wall at about arm's length. Place both palms flat against the wall at shoulder height, with your feet hip-width apart. Keep your body in a straight line from head to heels. Now push into the wall as hard as you comfortably can, as if you were trying to move it, even though it will not move. Hold that effort for 10 to 15 seconds while breathing normally, then relax. Rest briefly and repeat this effort 3 to 5 times. This exercise is especially valuable because it is gentle on joints. There is no motion to irritate arthritic knees, hips, or shoulders, yet the muscles of your arms, chest, core, and legs must all activate together. Research from McMaster University found that just 20 minutes per week of isometric exercise improved blood pressure, bone density, muscle strength, and overall confidence in adults over 65. Confidence matters because hesitation itself increases fall risk. Walking does not train this kind of coordinated response. When balance is lost, the body must react instantly. Isometric wall pushes teach your muscles to fire together quickly and safely. Over time, many seniors notice they feel more solid when leaning, bracing, or catching themselves during daily activities because their strength now arrives when it is actually needed. Now we arrive at exercise number 1, the one that quietly tells orthopedic clinics more about future independence than almost any other test after 75. The single leg stance looks simple, almost unimpressive. Yet research shows it is one of the strongest predictors of health and longevity in older adults. A large study published in the British Journal of Sports Medicine followed more than 1,500 adults over age 70 for 10 years. Those who could not stand on one leg for 10 seconds had an 18% higher risk of death from any cause and nearly a 3 times higher risk of experiencing a serious fall. That is not a fitness metric. That is a survival signal. The reason this matters is because walking hides weakness. Walking distributes weight between both legs quickly and never requires the body to stabilize on one side for very long. Real life is different. Every step you take is briefly a single leg balance. Every time you reach, turn, or step over an object, your body must stabilize on one leg long enough for the other to move. When that system fails, falls happen. Research from Germany found that seniors who trained single-leg balance reduced fall risk by 43%, a greater reduction than most other single interventions studied. Another study from the University of North Carolina showed that daily single-leg stance practice improved balance ability by 27% in just 4 weeks, along with measurable improvements in walking speed and postural control. To perform the single-leg stance safely, stand next to a wall, countertop, or sturdy chair. Lightly rest one hand nearby without gripping it. Lift one foot just 1 to 2 inches off the floor. You do not need to raise it high. Focus on keeping your standing hip, knee, and ankle steady. Hold this position for up to 30 seconds, then switch legs. If 30 seconds feels too challenging, start with whatever time you can manage and gradually build up. Repeat this 2 to 3 times per day. What makes this exercise so powerful is that it integrates everything at once. Balance signals, hip stability, ankle strength, core engagement, and reaction speed all work together. That integration is exactly what walking lacks. Orthopedic clinics often see patients who can walk long distances but cannot hold a single-leg stance for more than 5 seconds. These are the patients who fall while reaching into cabinets or stepping over thresholds. As this ability improves, many seniors report a quiet but profound change. Movements feel calmer, reactions feel quicker, confidence returns, not because fear disappeared, but because the body is once again capable of responding when it matters most.